Everything you need to know about sciatica explained by a physiotherapist.
So you think you've got sciatica. Let's talk about what sciatica is to start with. Sciatica is pain that runs from your buttock down into your leg. And because of where the sciatic nerve runs, you can get pain anywhere along your lower back, your buttock, your thigh, your leg, or even your toes. Sciatica is often caused by disc bulges, extra bone growths in your spines, or your spinal joints not moving properly, which then places pressure on your nerves with day-to-day activities. It can also be caused by tight bum muscles, particularly the piriformis muscle, because the sciatic nerve runs underneath it. And when that muscle is short and taut, it can do two things. It can either cause you deep, dull ache in your bum because it squashes on the nerve, or it can send you sharp shooting pains down your leg. And if you're unlucky, you probably will get both. Other causes of sciatica include narrowing of the foramina, which is where the nerves exit the spine. If that's become very narrow and small, it will place pressure on the nerve that exits. Pregnancy, because of the change of the woman's body as the baby grows bigger and develops in the belly, that changes the shape of the spine, causing pinching on the nerves. But also there's an increase in laxity in the ligaments as the body prepares for the birth. Tumors and cysts that grow around the spine can also cause sciatica pain. So that's something that physiotherapists and doctors need to look out for. And cauda equina, which is when you've got pressure on the bottom of the spine for various reasons. And that's an emergency thing that we need to look out for. And last but not least, mechanical trauma. So that means car accidents, falls, any big trauma that's happened to your back. Sciatica symptoms can present as pain anywhere along the sciatic nerve pathway. So that includes your lower back, your hip, your buttock, your thigh, your leg, or even your toes. It can either be a deep, dull ache or a sharp shooting pain, and sometimes it can be both. Because the nerve is affected, you'll often get pins and needles, tingling sensations, or numbness. Typically, it only affects one side of the body, and symptoms can be aggravated by long periods of standing, sitting, repetitive bending, or things like coughing or sneezing even. When to seek urgent help. Now, it's important to note that while sciatica is really common and will affect at least 40% of the world's population at least once in their lifetime, it's important to note that there are some things that you just gotta get medical attention for straight away and not just rely on YouTube and Google. If you have the following symptoms like severe pain, weakness in your leg where you don't have strength to stand on that leg, bowel or bladder problems such as incontinence, or if you have the urge to pee but you can't actually pee and nothing comes out, then you need to go to the hospital emergency department straight away, or at the very least see your GP because your spinal cord may be affected. Likewise, if your sciatica pain started after a traumatic injury like a car accident or a fall from a height, you may have a spinal injury that needs urgent attention because there could be a fracture or you could have pressure on your spinal cord. Now for the part that you're waiting for. I'm going to show you a series of exercises that work well for most of my patients at the physiotherapy clinic. Having said that, don't dismiss the value of a tailored program by going to your own physiotherapist or health practitioner that specializes in treating backs.
Knee rocking. This is a great exercise to loosen up the stiffness in the spine and to gently stretch and warm up the tight surrounding muscles. You see, your muscles do a great job of protecting the spine when it's injured, and this just starts to get those muscles warmed up and moving. Hug your knee to chest. This is a fantastic stretch that does two things. Firstly, it stretches the tight bum muscles and the surrounding lower back muscles, which takes the pressure off your spine. It also distracts and separates the vertebrae, reducing the pinch on your sciatic nerve. You can hug the knee towards the opposite shoulder for a stronger stretch on your buttock, or you can stretch out the resting leg for an overall stronger stretch, which I'll demonstrate as you keep watching on. Supine twist. Lift one knee up and bring it across your body. The supine twist stretches the buttock and the lumbar spine muscles, and it also opens up the foramina in which the nerve exits the spine, reducing the pinch nerve sensation. Supine twist also helps to restore normal spine biomechanics, that is, movements, especially when your spine has become stiff and rigid. But if you're suffering from a lot of pain, you can try the modified version of the supine twist as I'm showing you in the video right now. Because my back has no problems at the moment, I'm going to show you the traditional supine twist on the other side now so that you can see what it looks like. Like muscles, nerves can become tight and restricted. We're now going to do sciatic nerve glide. With sciatica, the nerve becomes stuck and restricted, and by doing this common physio exercise, it can help it get unstuck. Do this exercise gently though, and never push into pain, because your symptoms will be much worse if you're yanking on that nerve. Child's pose. This is a restful stretch and also popular in yoga practice. Its function is to open up the foramina in which the sciatic nerve exits the spine. The stretch reduces compression on the spine and it also eliminates stiffness. Piriformis stretch. The sciatic nerve actually passes under the piriformis muscle, and in approximately 10% of the population, it passes through the actual piriformis muscle. This stretch targets the piriformis muscle, which then reduces the compression on the nerve. Imagine that you're loosening and softening a muscle that is squashing on the sciatic nerve. Now onto my favorite part of the treatment, self-massage with a trigger ball, which is a firm massage ball. You can massage the following muscles with this ball, and if you don't have one, you can make do with a tennis ball, but I strongly recommend that you get one because it's useful for all sorts of muscles. We're going to start off with the bum muscle. You can cross your leg over for a stronger stretch, but if it's too hard, just have both feet on the ground. For a softer massage, or if your shoulders are problematic, you can massage your bum while lying down like this. You can roll your knees to one side for a bit more pressure, or roll your knees to the other side for less pressure. You can use the trigger ball to massage your back muscles. Lay on your back with your knees bent and place the ball on the muscle next to your spine. Now it's important, do not put that ball on your spine because it will make it worse. You can roll your knees side to side for the pressure that you like, and for extra pressure you can hug the knee towards your chest.
Now, for some additional information. Have you tried everything that I've mentioned so far and still you're in a lot of pain? Well, avoid doing the following activities. Excessive bed rest. That includes lying on the couch or the recliner chair or even on the floor to rest your back. What you're doing is actually weakening your back muscles so that when you stand, your back pain and sciatica will become worse. 2. Keep moving. Avoid being in certain postures for more than 30 minutes when the pain is bad. This is the advice that spinal surgeons give to patients straight out of surgery because being in one position for too long places a lot of stress and strain on the lower disc of your spinal cord and causes the surrounding muscles to shorten and tighten. 3. Maintain proper posture. There is no point in doing all of this work to treat your back and then after that for you to retreat back to a poor, slumpy, slouchy posture. A slouch posture places a lot of strain on your back and also on the disc, increasing the likelihood of worsening your symptoms. 4, and most importantly, I believe this is probably the most important fact, do your core exercises. When physiotherapists talk about core strength, we're not talking about planks or sit-ups or getting a six-pack, although that would be really nice. We're talking about deep muscles that wrap around your lower body from your abdomen to your spine. Core muscles protect and support your spine like a natural back brace. You know, the ones that everyone rushes to the chemist to get when they've got back pain instead of doing the hard work like exercise? When your core is weak and saggy, more stress and strain is placed on your lumbar spine, particularly your disc and nerves. Also, when your core muscles are weak, the surrounding muscles overcompensate, causing tightness in your hip muscles and your bum muscles, which can also impact on the sciatic nerve. The benefits of seeing a good physiotherapist for treatment of your sciatica pain. Although going onto Google or the internet and trying exercises that you found can relieve some of your pain, like this video, still nothing beats seeing a good physiotherapist who knows what they're doing in person, because a good physiotherapist with experience can fast track your recovery, helping you get better faster by tailoring treatment and exercises to your specific needs. Because everyone's spine and body is different, and it's just good to get someone who can assess you properly in person. Be sure that the physiotherapist that you're going to is actually a good physiotherapist and not one that just places a heat pack on your back and does a little bit of fluffy massage. Or, God forbid, put machines on you and then leave, because that's not going to get you better. And over the last 20 years of my physiotherapy practice, I've had to treat a lot of patients that have come from other physiotherapists who haven't done the right thing by them. So unfortunately, out there with every profession, there are professionals who are more concentrated on profiteering off their patients rather than equipping the patients with the right knowledge to get themselves better. Now, I'm going to tell you a couple of things that a good physiotherapist will do for you on your first session when you see them. A good physiotherapist will assess your movement, your muscle imbalances. They'll do neural tension tests on you. They'll do neurological tests. So that's testing to see if any nerves are compromised. They'll assess your posture and they'll explain it to you. They'll assess your hamstring length and they'll also look at your core activation, just to name a few things. From your physiotherapist's first assessment of your condition, they should be able to devise a plan which will include some gentle hands-on therapy to restore normal spinal movement and loosen up tight muscles surrounding the sciatic nerve like your lower back, your hip and your buttock area. They will also give you a couple of new exercises at each session that will help you to restore your normal flexibility, your core strength, and also your overall lower body strength to prevent future back injuries. Because let's face it, we don't really want to see you come back to physiotherapy unless you need to. Typically, treatment can take up to a couple of weeks and up to 3 months if you're following the physiotherapist's instructions. If your symptoms are not improving, then the physiotherapist should tell you to seek a specialist opinion and surgical intervention may be required. If you found this video helpful, please give me a like and subscribe to my channel. I appreciate your love and your support. If you want to follow along core and stretch workout for sciatica pain specifically, one is in the works. And when I finish that video, I'll link it to the description below. Almost didn't know what I was going to say then. In the meantime, take care of your body and I will see you in the next physio workouts video. Bye!